delivery. This can look a little different depending on hospital setup, and it can also look a little different depending on if it's an emergency C-section or if it's scheduled. Maybe your provider doesn't feel comfortable delivering a breech baby who's, not head down vaginally. Maybe it's your baby is something's going on with your baby and it's safest to have a C-section for them. Or maybe there's something going on with you where medically you aren't doing okay, and so you end up needing a C-section that's scheduled. Or it may be an emergency situation where it's turned into a C-section because either you or baby aren't doing well, or it may be any other thing that's not planned but ends up happening. So before your C-section, if you are coming in for a C-section, or whether it's a vaginal delivery that turns into a C-section, you're usually going to start in your labor and delivery room. Some bigger hospitals do have, if it's a scheduled C-section, a pre-op area that you go to that is where they get all the information from you like they would typically do in a labor and delivery room. So they're going to go over consent. They're going to talk to you about what a C-section is, a cesarean delivery. They're going to get some lab work from you. They're going to start an IV. A C-section is major abdominal surgery, and sometimes I think we kind of go over that. Oh, it's just a C-section, it's no big deal. And while plenty of women do have C-sections and they're totally fine and everything's okay, it is a major abdominal surgery. There is a lot of things going on in here, and I just don't want you to brush it off thinking, oh, I had a C-section, it wasn't a big deal. That was a big deal of how you birth your baby. And so like I talked about, they're gonna get your consent, they're gonna start an IV, get your lab work and everything for you. They're gonna have people come in and talk to you. So you may have baby's nurse come in and talk to you before delivery. You're gonna have your labor and delivery nurse in there with you. The provider should come in and talk to you and get your consent. You may have the anesthesiologist come in and talk to you as well. After all of this, they're going to take you to the OR. So typically they take you to the OR by yourself first before anybody else can come back. They'll go ahead and put a spinal in if you already don't have an epidural. It may have been one of those situations you had an epidural and then it turned into a C-section and they don't end up having to do a spinal. That can happen. Even if it's an emergency situation, a lot of times they can still do a spinal, but if it's a true emergency, baby's down, things aren't going well, they can put you under and they won't worry about having a spinal put in. And so there's still ways that they can go about that. I bring that up because sometimes providers come in, or anesthesiologists, and they're really pushing an epidural because they say, well, if it ends up turning into a C-section, we're going to want to have that. But they can put you under anesthesia. That way you can still have it and get baby out. And so if you want to have an epidural, you can, but I just don't want you to feel like you are pressured into doing one thing or another if it's not what feels best for you. Okay, so they're taking you to the OR. You're going back by yourself. They're going to put in a Foley catheter if you already don't have one in. And I'll talk about that a lot more during peeing postpartum, but your uterus is right next to your bladder. And so I bring this up because sometimes I have people on social media say, how can I not have a Foley if I'm having a C-section? I would be amazingly surprised if this was something that was ever done, because as your bladder fills up, it pushes on your uterus and it pushes your uterus over. And it's just too much of a liability and too unsafe to do a C-section and cutting inside of your uterus that's all of a sudden moving. Nobody wants to do surgery on a organ that's moving around, right? And so they're going to put in the Foley catheter that's going to drain your bladder. They're going to get everything all set up, and then they're going to have your support person come into the OR with you. Different hospitals have different policies about who can come in and how many people and all those things. So ask that and have whoever feels like they're going to be the best support for you. They can come back and bring a phone with them. I've had people listen to music inside of the OR. Do whatever feels best for you. And do what they call a timeout. This is when they get the OR silence and they ask you, what's your name? What's your date of birth? Do you have any allergies? And what are we doing for you here today? You're having a cesarean delivery, a C-section, and they're gonna just make sure everything's right before they get started. Most hospitals you think of when it comes to having a C-section, or I do anyway, you think of like their arms being on the boards. They have that big drape that is in between you and baby, and that just keeps the area over there sterile. But there are different ways that this can happen at different places you may see. Clear drapes are really cool things. It's like a see-through curtain to be able to actually see your baby born and to see them the moment they come out. It's a really cool thing. But some hospitals, they only do it upon request, which is hard if you don't know that it's even an option. So you can go ahead and ask them, hey, do you guys have clear drapes? That's something that I would really like. Have that conversation with both your nurse and your provider. It can be one of those things you're asking them even in the office if you're having a scheduled C-section, or if you just want to know during your pregnancy appointments. There's also what they call a mom-assisted delivery. This is something that's more new that's happening that I think is just so cool. They will only do it if it's not like an emergency situation. But this is where the mom gets all sterile just like the provider would, and they go ahead and they can actually help birth their baby from their stomach and can just be more a part of it. And so I have a picture in here, and I just think that and clear drapes are just the coolest. But if for some reason they don't have that options, or maybe it's an emergency situation and they're not able to do a mom-assisted delivery, they can lower the drapes for you whenever your baby's born. It's a really great time to like take pictures during this time. Anesthesiologist, I think, is one of the best people for taking pictures. They're at your head. They can take those for you. The nurses can take them if it's not an emergency situation. Those are options that you have. Anesthesiologist is a really great person to talk to if you're feeling nervous about the C-section. It can be really scary and overwhelming. It's a very unfamiliar place. If you don't work in hospitals all the time like me, that OR may seem really intimidating. And so they're a really great person to talk to you through it. If you're having any kind of anxiety or just like questions during the middle of it and want to kind of know what's happening, they're a great person. Like I talked about, music is an option, taking deep breaths, guided imagery, things like that, of just trying to during the C-section, because it can be a little scary and overwhelming. So during the C-section, you shouldn't feel any kind of pinching, sharp pain. They will test this before they actually start having the C-section by like pinching you usually, but you shouldn't feel any of those pains. You will feel pressure, and sometimes you will feel more pressure on the provider side. There tends to be more tugging on the provider side. Sometimes after the C-section, you may feel more sore on that side, or you may have more bruising on the side the doctor was on. So you may feel some tugging going on, and you also feel some pressure as your baby is like birthed out, so to speak. So someone typically is like on your chest, kind of helping push baby down through the opening that is happening as the provider is in, and helping pulling them out. If it's not a true emergency C-section where they're needing to get baby out, baby's not doing okay, maybe something's going on with you and they need to go ahead and get the placenta and everything out like right away, they can do delayed cord clamping inside of the OR. I have some doctors that I've worked with where even when baby's looking a little iffy, they still do delayed cord clamping for a minute. They're saying out loud, we're doing delayed cord clamping for a minute. And I think, geez, can you hurry up and get that baby over to me? But delayed cord clamping is an option that you still have even with the C-section. So I would just make sure that you're having that conversation if that's something that you want. After your baby's born, if everything's okay, a couple things can happen. They can either go straight to you skin to skin. They can kind of like hang out for a second before going over to the warmer, or they can go over to the warmer, whether that's right away or in a couple moments if you're doing minutes, however long you choose to delay for. But they'll go over to a warmer. That's a special piece of equipment that we have that has a warming lamp on it, and then it also has a lot of equipment on it in case your baby does need some more support. A C-section, just like mom is a major abdominal surgery, we're a little bit more worried about those babies, and I'll talk about that a little more in newborn section, but as of why we're worried about them. But there is typically a lot of equipment that is over there just in case. We in the hospital are always anticipating the worst and want to be well prepared just in case. Even if yours is a routine delivery, we have it there in case it's not a routine C-section and it's an emergent thing that we're anticipating. So anyway, that's what a warmer is. And you may have a lot of people over at the warmer, which can kind of feel scary. Wow, there's a lot of people inside the room here with me. Why are there so many people over there? They typically want more people at a C-section delivery than they would a regular vaginal delivery for both mom and baby. And you may have more people over there if it's emergency C-section. There's people orientating, training, student nurses. There's a lot of things that happen inside the hospital that they may not be people who are actually helping your baby, but just observing and learning. So they'll go over to the warmer. They'll dry your baby off. They'll give them any kind of extra support that they may need, stabilize them. And then your support person can come over and take pictures if you want. Typically the warmer is kind of close to you and you can see what's happening, but they'll go ahead and weigh your baby at this time. You can take pictures. They will trim the umbilical cord. So they'll clamp the cord over at you, bring baby over. If your support person wants to trim the cord, they can trim the cord at that time as well. And I'll talk about everything with that when we do the umbilical cord in the newborn section. They can have pictures taken, baby can be wrapped up, brought over to you. You guys can all have pictures taken at that time. I keep talking about pictures because I guess I do a lot of picture taking in the OR, but they can also be skin to skin on you as well. This kind of depends on how you and baby are doing, depends on if that's something that's able to happen. And sadly, it also kind of depends on staffing. If the nurse is able to stand there with you guys, or if baby's okay and needs to be monitored a little closely. If I have a baby who they're stable, they're okay, they don't need more support, but maybe I'm just a little bit more worried about them, I'm not really inclined to just leave baby and go. I do think skin to skin, we'll talk about that in the newborn section, is one of the best things that you can do for a baby in those early moments, especially if they're struggling, but not at the point of needing support. So you can be skin to skin if the nurse is able to be in there with you. If not, or if baby is not doing well, they may have to bring them to the nursery during that time. A lot of times the support person can go with them, and so just communicate that with them. Hey, if something happens with my baby, will my support person be able to go with them? I want to make sure, you know, they're able to come as well. And so having that communication is really important as of what you want. Okay, so once your baby is stable, and once you are stable, they'll go ahead and sew you up, and we'll go over an incision care about that, but there's multiple layers that they are sewing up. They're going to get you all cleaned up and take you back typically to the labor and delivery room that you were at before, or a post-op area as well. You're going to be over there for about 2 hours is what you will typically see in most hospitals. That's usually when the time of a postpartum complication being the highest happens. So they want you to be monitored a little more closely. So you'll be over there before going over to postpartum. Initially after your C-section, you may kind of feel out of it a little bit. You may also feel nauseous. They typically will start you off with like ice chips and then crackers or jello before moving over to food. But you may feel really nauseous. They have medication that they can give you. Cool packs can kind of help with that as well, especially on the back of your head or your forehead if a mom's feeling nauseous. You can also take alcohol wipes. This sounds very bizarre, but it does work. And open the pack and put it under your nose and smell it, and that smell can actually help get rid of the nausea feeling. They have different patches they can use, just kind of like a cruise ship, how you may have like a patch. They have different IV medications, one that dissolves under your tongue, different things like that that they're able to do. Usually because you have the IV, we're doing that first. I always like to have a throw-up bag in all my C-section rooms because it is something that happens. And then you may also feel really itchy. So this is one of those like weird things that not enough people talk about. And I remember texting my best friend who had a C-section because her baby was breached, and where she delivered at, her provider wasn't comfortable doing a vaginal breech delivery. So she had a C-section, and her water ended up breaking early, and she went in earlier than anticipated. And I remember texting her saying, hey, if you feel itchy, make sure you ask for something. And she thought, that's so weird. Why would I feel itchy? And sure enough, she was one of those unfortunate people that did feel itchy after her C-section. So a lot of times they'll start on your face. Your nose is like a very common one I see. So you'll be really itchy on your face, on your nose, and it just kind of goes all over, and you kind of feel like you're going crazy. It's because of the medicine that they give you inside of the OR. And it takes about 24 hours for everything they give you inside of the OR to be out of your system. And so we can give you medications to help with the itchy. They usually make you more sleepy, but I guess if you're sleepy, you're not itchy. And so it's kind of, you got to play on that. But it usually takes about 24 hours for that to go away. Cool rags can also help with itchiness, so you can do that in cool compress on different spots that you may be feeling the most itchy. But even though you do feel kind of crazy, it is really annoying, just know that that's normal and it should get better over time. Walking after your C-section is highly encouraged, not only after any time postpartum, but after major abdominal surgery. You're gonna want to be up and moving. This usually happens about 6, sometimes 8, 12 hours after delivery, but as soon as we're able to get you up, we want to. Whether that's just standing up and walking over to a chair, maybe that's standing up, going to the bathroom, getting everything cleaned up, and then walking in the hall before coming back to the room and either back in the bed or in a chair. We really encourage that because it helps promote healing. The part of getting up after a C-section is the worst part. Getting everything to kind of stand back up is not fun, and the process of getting down isn't fun. Those abdominal muscles just got cut. There's a lot of stuff going on there, and so it may feel more sore during that time, but once you're up and moving, it actually feels really good to be up and moving. They can put an abdominal binder on you. It's just like a belly binder, you may hear it called, that wraps around you. I encourage it for all moms postpartum, but C-section moms, man, I really encourage it for that. They give it to you inside of the hospital. It may be something you have to ask for, and if they don't have them, it is something you're able to easily find online. It helps with your recovery though for a lot of different reasons. One, it will help with you peeing. It helps with gas pain. It helps with overall soreness that you may be having. It helps with you not developing blood clots. It's really important for a lot of different things. So as much as walking may not be fun postpartum, especially after a C-section, it is really encouraged. So they're going to get you up, you're going to be walking. The first time you get up after a C-section is by far the worst time, but it should be something that gets better and better every time. The first time you get up, you may have kind of a gush of blood. Unless the nurses worry about it, try not to get super worried about it. But all of that blood was just sitting there in that vagina and was just pooling right there. you get up and you start walking and it's naturally gonna come out. And so you may have a little bit more bleeding the first time. You may get kind of more nauseous the first time. It may just kind of feel weird getting up. So that's where those vomit bags, the alcohol wipes, an ice pack for the nausea really comes into play that first time getting a mom up. So you may get nauseous the first time getting up. I've had moms like pass out on me the first time getting up. That isn't to scare you. It's just, I jokingly tell moms when they feel like they're doing really bad, when we make it to the toilet and get cleaned up and they're like, whew, like, sorry this is taking so long. I'm like, no, it's okay, you're doing great. If you don't pass out or throw up on me the first time getting up, we're making progress and I'm okay with it. So if you're taking your time getting up, that's totally okay. Take all the time you need, slow moving. So you're gonna get up, typically go to the bathroom, get cleaned up, get panties on and all those things if you don't have them on, and we're just encouraged walking. Some hospitals take out your Foley catheter at like 6 hours postpartum, some's 8, some's 12, depending on how the provider orders it and kind of the hospital policies. But typically we like you to get up and moving before taking out a Foley catheter. Some places take out the catheter and then get you up moving. So really whatever is happening. And then after your Foley catheter is taken out, we like you to typically pee 6 to 8 hours after that's taken out. And I'll talk more about that in the peeing section as well, but that's just something to kind of anticipate. That's all I have for the C-section, what's going to be happening. And next we're going to talk about incision care. But I do think having a good conversation with your provider, if it's a scheduled C-section or if you have plenty of time, if it's turns into a C-section, and just know that even though it is surgery, even though it may be something that's out of your control, you still have every single right to ask all the questions. You can still let this experience be whatever feels best for you, and you may get pushback on certain things. But if you want to do delayed cord clamping, if you want a clear drape if it's there, if you want your support person to be able to go back with your baby if they have to be taken to the nursery, if you want to change in your own clothes, whatever you want to do that feels best for you, that's okay. And I just really encourage you to have that conversation with your provider and to have that conversation with your nurse, and know that just because you're having a C-section, major abdominal surgery, that's the way you're delivering your baby, that doesn't change anything else, that you still know what's best for you and your baby, and that you still have control over things that may feel out of your control.